Secretary for Health of the North Carolina Department of Health and Human Services.
Thank you, and good afternoon. I'm Deborah Farrington, Deputy Secretary for the Department of Health and Human Services, and I'm happy to have you join this afternoon's discussion. I have the distinct pleasure of being able to introduce some distinguished guests, and I would like to start by welcoming our Secretary, Dr. Davida Sangvi, with DHHS. Dr. Sangvi?
Thank you, Deputy Secretary Farrington, and thank you everyone for joining. You can tell by the turnout that this is an important topic and one of interest to so many of us. As many of you know, we learned late last year that North Carolina was awarded $213 million as part of the Rural Health Transformation Program. That's something to celebrate. We would not have been able to do that had that not been for the phenomenal turnout when this notice first came out of all the great ideas and all the important issues we have facing rural North Carolina. This is a unique opportunity here in 2026, but we actually can go back far as 1973 when North Carolina recognized the importance of rural health and the importance of the 3 million people who live in our rural communities when we established the Office of Rural Health that's part of Deputy Secretary Farrington's portfolio. So rural health is not new to us. What's really new to us is this remarkable opportunity. When the RHTP was passed in July, our department was ready to take on this unique chance for funding that will extend out to 5 years to really transform rural North Carolina. North Carolina DHHS worked quickly to develop our state's plan, and as I mentioned, we had over 420 responses, 420 ideas, 420 of you who came to us with ideas on how we can transform rural healthcare in North Carolina. As I mentioned, over the next 5 years, the funding will help us think about how we create sustainable change in these communities where oftentimes access is the biggest problem. But we're also looking to involve community partners, local, state, and other stakeholders, our federal partners. This is really once in a lifetime opportunity to transform healthcare in North Carolina. I'm grateful for these federal dollars, and we're eager to work in partnership to prioritize the health and well being of North Carolina. We'll use every opportunity to advance healthcare for all. Sharing the mission and vision of Governor Stein, who envisions a North Carolina where everyone should be entitled to good health regardless of where you live or how much money you make, is really embedded in this concept of the Rural Health Transformation Program. And I'm excited to introduce the governor for some introductory remarks. Governor Stein?
Thank you very much, Secretary Sangvi. I very much appreciate your introduction and your leadership of the Department of Health and Human Services. Good afternoon, everybody. It's great to welcome you all to this town hall discussion on the Rural Health Transformation Program. As we all know now, North Carolina's number is $213 million. That's what we have for this year. And this funding will improve healthcare delivery for the more than 3 million North Carolina residents who live in rural communities. It's going to bring over the next 5 years about $1 billion in federal investment to the state, and it's going to advance access to healthcare in the rural parts of our state. It's going to support rural healthcare providers. It will advance our efforts in preventive care, chronic disease management, behavioral health, maternal health, and nutrition. It will invest in our rural healthcare workforce. We're committed to working together with the various agencies, the General Assembly, and our congressional delegation to achieve success with this program. And we're committed to collaborating with all of you who are invested in improving healthcare delivery in the rural parts of the state, our hospitals, healthcare providers, community health centers, local health departments, tribal communities, academic institutions, community and faith-based organizations, nonprofits and private sector partners, and many others. Together, we will set an example here in North Carolina for the nation of what can be accomplished by working together. I want to thank the many people at North Carolina DHHS who worked tirelessly in a short, compressed time period to secure these funds. The department led with a clear vision for maximum impact. And I want to thank the hundreds of stakeholders who DHHS consulted while creating the plan. Your input and ideas made the state's plan stronger. Through the RHTP, North Carolina DHHS and other state agencies will continue to work with the federal government over the next 5 years to improve the health of North Carolinians and to secure the funds we need to expand access across the state. We have to remain mindful, however, that the same federal legislation that created the RHTP also cut Medicaid here in North Carolina by $50 billion over the next 10 years. It is without doubt that these cuts will inevitably hit rural communities hard. My team and I will continue to urge the Congress to do right by the millions of North Carolinians by redressing these devastating cuts to Medicaid, and I know that each of you will do the same. So thank you for being here today to learn more about how we're going to implement the Rural Health Transformation Program. And at this point, I'll hand it back to Deputy Secretary Deborah Farrington. Thanks everyone for being here.
Thank you, Governor Stein. Your exemplary leadership has been crucial to our efforts, and we're excited to be able to continue to lead this initiative under your leadership. We appreciate you so much. And we're so thankful for all of you who've joined. Our numbers continue to rise, but we do want to be respectful of your time. And so let's jump right in to today's agenda. So you will see that today we intend to provide an overview of the Rural Health Transformation Program Award and what the receipt of these dollars mean for North Carolina, especially rural North Carolina. We also will be providing some highlights about the initiatives at a high level, talk about what they mean and what opportunities we have to implement those initiatives. We will be looking ahead at some key activities that the department will be engaging in and steps that we'll be taking to make sure that we can be successful. And I'm thankful that we have a distinguished list of panelists, other voices within the department who were critical in the development of our application, who will be able to speak to some of the ways that the Rural Health Transformation dollars will benefit our state. The Rural Health Transformation Initiative is a unique opportunity for us to leverage the $213 million to transform rural health in North Carolina. I would note that the Rural Health Transformation Program is a cooperative agreement with CMS that will require ongoing and substantial federal involvement. This program is going to support our work to address the needs of nearly 3 million rural residents in North Carolina, those who have significant chronic health disease issues, perinatal health needs, and mental health needs. This is evidence, as you can see outlined on this slide, by 17% higher diabetes rates in North Carolina, in rural North Carolina, compared to urban areas. We have maternal care deserts and higher pregnancy-related mortality in our rural communities. And additionally, we have higher infant death rates in rural communities as well. You all are well versed with the workforce shortages that exist in our rural communities. And over the last 10 years, we have seen too many closures of rural hospitals. Rural residents need the ability to be able to access digital means of care, and that's impacted by limitations and broadband gaps. We also need our rural residents to be able to access telehealth, and they need more supports with literacy in order to understand how to better use telehealth services. And finally, rural health transformation means a lot to our state because over the next 5 years, we'll have an opportunity to get, as the governor said, up to $1 billion to address our needs. The $213 million year one investment will put us well on that path. The next slide talks a little bit about how we will go forward in the implementation of the Rural Health Transformation Program. You all know, as was mentioned earlier, our application was built on input from more than 420 partners in our community. And as we mobilize to implement this program, there are certain guiding principles that will be helpful as we begin this next implementation phase. And I'm going to take just a few minutes to walk through those guiding principles. We think these are important because it will shape our interactions with you. It hopefully will provide some clarity about how we will be doing the work in the coming months. One of those principles is that we want to maximize resources for rural health. We want to use the available funding to us, our partnerships that already exist in our communities, and our expertise to make sure that we efficiently strengthen healthcare access in our rural communities. Ultimately, we want to also see improvements in health outcomes. The next principle I want to talk to is building out details on high-level approaches. We wrote our application in a way that was quite responsive to the federal requirements, but in some cases that meant that we had to describe what we were going to do at a very high level. What we intend to do over the coming months is to translate those strategic goals and the contours of our application into accountable strategies with clear timelines, clear responsibilities, and measurable milestones that we'll be focused on. We also want to achieve quick wins. As you may have heard, as we've talked about this new program, year one successes are vitally important. And so we want to make sure that we identify and implement initiatives that deliver immediate, visible benefits to our communities and to you as our partners. We also want to make sure that in this critical year one period, that we are building momentum towards achieving some long-term goals. We also want to plan for long-term sustainability. This is a 5-year initiative, and those initiatives, all 6 of them, must include a long-term sustainability plan. We're going to be thinking about that now as we begin to implement our Rural Health Transformation Program. We want to prioritize, and we plan to prioritize, measurable community level impact. We're successful today and have gotten the response we believe in the approval of the award because of the input from our partners and because we've been highly engaged with community members. And so we want to make sure that our initiatives include clear metrics and baseline data and targets to make sure that we can describe accountability, that we can talk about the scalability, and we can also show local relevance. We want to employ flexible and agile approaches and pivot when needed. We want to be adaptable. We will adapt our strategies in response to the changing circumstances, changing and ongoing feedback that we get, and emerging opportunities to make sure that we are effective and relevant. And if I could just stay there for a moment, we want to make sure that we act quickly, but that we can also pivot, as we've said before, to make sure as we get new information that we can move expeditiously to change and be responsive. And finally, we want to communicate transparently and with integrity. It's a core value of our department, and we intend to remain true to that. We will share information with you openly and honestly, while we also want to safeguard sensitive details and build trust and maintain accountability. As we start to enter different procurement phases over the coming months, it will certainly shape how much information and the type of information that we can share, but we intend to remain open and transparent in that communication. I'll take a few minutes to review our initiatives. You all know that there are 6 interlinked initiatives that were developed as a part of our overall application. These initiatives align with federal requirements and goals of the federal RHTP program. And I know there's a lot of detail on this slide. You'll have access to the slide after the presentation is complete and have an opportunity to dig into more details. But let me just highlight a few points about each of the 6 initiatives. Initiative 1 is the North Carolina Roots Hubs. These are locally governed networks that are targeted to improve health outcomes in our community. They will work with these networks of entities, including providers, to address many of the other initiatives that are a part of our application. Initiative 2 is focused on expanding primary care and preventive care, particularly addressing chronic disease and maternal health needs in that bucket of work. Initiative 3 is focused on behavioral health and substance use integration. Initiative 4 is targeted to address our workforce development and expansion. We want to attract and retain a viable workforce, especially for our rural communities. Initiative 5 is focused on sustainability through a value-based payment system. And then our final initiative, Initiative 6, focuses on how we can use technology and data-driven solutions to address health outcomes in our rural community. Across the lower part of this slide, you'll see that we've put some emphasis on that we want to be able to measure success and demonstrate through this initiative how we're reducing chronic disease rates and the burden of chronic disease on our communities. We want to improve access to care. We want to address our workforce vacancies and see a reduction in the number of workforce positions that are vacant. And obviously, we want to track the adoption of technology and the implementation of new data tools in our rural clinic and outpatient settings. We aren't allowed, and we're very careful that we want to adhere to some of the requirements of CMS. We're not allowed to supplant Medicaid cuts, although, as the governor mentioned, it is something that is of serious concern for our communities, the reductions that we've seen in our rural providers. We want to make sure that projects that are not measurable are not a part of this initiative, and we want to make sure that we're not creating further silos in this effort. What are we going to be doing in the next year to implement rural health transformation? You'll see on this slide that we've broken out sort of 2 buckets of time periods for the next year. The first bucket, January to March of 2026, highlights some of the key milestones that we'll be working on, including the submission of our revised budget to CMS, which we will turn in by January 30th of this month of this year. And that's our year 1 funding for the $213 million award that we received. We also obviously need to establish the programmatic and management structure for the Rural Health Transformation Program. And that means we'll need to be looking at what do we do within our department, but we'll also want to focus as well on how do we continue to establish some bodies within the community that can help guide and advise us on this work. We do intend to release a request for applications for the Root Hubs lead entities, and we plan to do that in the first 3 months. The activities that we're focused on in the first 3 months is designed to help us achieve some of the quick wins that I referenced earlier. Between April and October of this year, we will conduct the awards process for those regional hubs. We intend to select and onboard those regional hubs, those lead entities. And we will also ask those regional hubs, once selected, to develop their action plans, to establish their local governance, and engage community members in their implementation processes. We want to be able to expand the reach of some existing statewide initiatives as a part of the Rural Health Transformation Program. And you see those listed here on the slides. We want to expand what we're doing in the behavioral health space, do more for perinatal mental health support, increase HIE participation, and a few other items that are listed on this slide. In August, we'll be submitting our first annual report to CMS. And as throughout the months to come, we'll continue to engage with you and create opportunities for community members to be involved and informed about what we're doing. And I think I'm getting close to the last slide here. So the last slide sort of described what we were going to be doing over the last the coming year, uh, not quite that long, but over the coming 9 to 10 months. This slide talks a little bit about how we're going to laser focused in on what are we going to be doing immediately in the coming days and weeks. So I talked about our need to be agile and to pivot and to be flexible during this period of time. And so we're going to be focusing a lot on sort of what are the key implementation steps and activities that we need to engage in. We had an implementation plan that was part of our application, but we need to build a lot more detail into that plan, and we'll be doing that and communicating with you all about that. In addition to building out the implementation plan, we need to put some specific requirements around each of those initiatives, 1 through 6, that I described earlier. In our application, we described our program goals and broadly what those initiatives would look like. Now we have to get to the detail of sort of building out those operational steps. It's more of the how are we going to get to that bigger picture design. We'll continue to engage with you, and we've listed here some ways that we will do that. We certainly will use our existing forums. The side-by-side meetings that are happening in our mental health space is an example of that. I mentioned that we will be designing and implementing a community advisory group, and we will start to initiate some standard ways of communicating with you as our community partners. One of the reasons we want to do that, as I mentioned earlier, is we want to protect sort of the procurement processes that will come in the coming months, just to make sure that we don't create any inadvertent conflict of interest. So we'll be clearer with you in the coming weeks and months about sort of that standard communication. If it feels like we're sort of communicating differently, the reason for that is we just want to make sure that we're honest, open, and transparent, but we're also doing it in a way that's fair for all people who are interested in getting engaged. So what can you do to get involved? Please continue to visit our webpage. We intend to let that serve as a source of truth for information about Rural Health Transformation Program. Certainly respond to requests for applications and other procurements that are put out by the state or the regional entities. And then once these regional roots hubs are identified and designated, we certainly encourage you to contact them and to become partners with them. And then again, participating in existing groups is certainly a great opportunity we want you to take advantage of. So that was a lot. I hope that it was helpful to you. And as I mentioned before, we will make sure that you get this information after the town hall today so that you can dig into some details and reference it later. So thank you all for participating in today's town hall meeting. And I mentioned that we have some panelists here who can help sort of bring their voice and experience to this discussion. And so we're gonna pivot so that we can invite our panelists to join us. So I'll ask that each of you please come on camera. And what we're going to do is I'll thank our panelists for joining, and I'm going to ask each of them if they would just take a few minutes to introduce themselves and talk a little bit about what the award of this Rural Health Transformation Program funds means for them, what you think the areas of their responsibility, and what you think it means for North Carolina. And Dr. Greenblatt, you're the first person I see, so why don't I start with you, and then you could pass it on to one of your colleagues. Please tell folks who you are, briefly your role within the agency, and then share about your hope for this program.
Thank you very much, Deputy Secretary. My name is Larry Greenblatt, and I serve as State Health Director and Chief Medical Officer for North Carolina DHHS. And I am an internal medicine physician by training, and that means I provided primary care and earlier some hospital care to adults. And I have extensive experience with Medicaid and working with folks in rural communities as well as urban centers. And to me, this is really potentially a generational opportunity to invest in the kinds of things that we really need to be investing in for our rural communities. We have a fabulous workforce, and people do just really important work there. There are many challenges, and I can talk about those later, But I think that this is an opportunity to invest in the kinds of things that will make a difference to the individuals living in those communities, to improve their health, but also to recruit and support the workforce that's out there in our rural counties, and we have 85 of them. And I'll hand it off to Kelly Crosby.
Thank you so much, Dr. Greenblatt. Hi, everyone. My name is Kelly Crosby, and I'm the director of our Division of Mental Health, Developmental Disabilities, and Substance Use Services. So I'm actually, I always say I'm a mountain girl. I was raised in a really tiny mountain town, actually in Pennsylvania, but very rural, very much like North Carolina. And so I am incredibly excited about this grant and this opportunity. I have the privilege of being able to travel across the state every single week. In fact, shout out today, I was in Kannapolis on the Rowan County side. That's actually really important to know, the Rowan County side. And I get to work with communities every single day who struggle to find access to adequate mental health and substance use treatment. It's really tough. It's very tough in rural areas. We have workforce shortages, and it's just tough to have access. So we're very excited about some of the initiatives in the Rural Health Transformation Program. So around the mental health space, we are really going to look at investing in, or we're going to invest in our community, our certified community behavioral health clinics. That's a really fancy name to say. It's just your safety net mental health agency. We have some of them in North Carolina. We're going to get a few more, and we're going to help the ones that are currently existing. It's a place where you can go for an assessment. It's a place you can go to get primary care, or at least coordination with primary care. You can get care management. So it's just a familiar place in a neighborhood where people can go for access. And a really critical part of that is all of those spots are linked to crisis care. They either provide crisis care, they serve as a regional hub for crisis care, or they've got a crisis partner. So crisis services are a critical part of this rural health transformation program too. And for all of our programs, the CCBHC one, that safety net mental health substance use treatment place, the crisis system, we're going to rely on existing infrastructure. So all of this will be done in partnership with our LME MCOs, with our local providers and counties, and we're going to build on things that work. So we're going to be building out our crisis system on things that work. We're one of the most successful 988 programs in the country. We have 33 mobile health crisis teams across the state. We're about to have 25 behavioral health urgent cares and a lot of facility-based crisis beds. But again, rural areas are the hardest hit, right? They're really where we need mobile access and regional crisis clinics. So we'll be building on the infrastructure we have to really enhance those services in rural areas. And lastly, again, we're well known across the nation for having access to medications for opioid use disorders. But again, we struggle in rural areas. So we're going to use this as an opportunity to get our mobile clinics into rural areas. We have 2 up and running in North Carolina now, super proud of those. And we hope to build additional or bring additional mobile units to rural areas in partnership with clinics, with churches, just so we're getting life-saving medication to rural areas. So there's wonderful opportunity. The last thing I'll say really quickly is workforce, right? We're doing some exciting things in the workforce space, but this will allow us to pay particular close focus on rural areas. So we're able to get well-trained and qualified. We need well-trained and qualified, right? If you're going to have a lack of access, let's make sure the folks that are there are well-qualified and well-trained. And we're able to do things like loan forgiveness and training through community colleges. So we're really maximizing to get local folks trained to meet the needs in rural areas. So really excited about those workforce opportunities as well. And now I have the privilege to turn this over to kind of our rural health queen, Maggie Sauer.
Thank you, Kelly. I don't know how to follow that. Hello, everyone. I just can't tell you how thrilled I am to be here with all of you. You know, as Kelly talked about, I grew up on a ranch in eastern Colorado where it's 15 miles to get to the nearest whatever you needed. And I've privilege of also having family here in North Carolina. So I'm just really thrilled to be here with all today, and a big shout out and thank you for all of our rural partners and friends who have joined the call today. The Office of Rural Health has been really privileged to serve the state of North Carolina for over 50 years. And part of that has come with the idea and the value that we walk beside you, not in front of you. We do this work together with our communities. And if you hear anything from me today, I think it is the fact and the notion that this is community-based, community-led, and it takes everybody. If you grow up in a rural town, you know that that takes, I mean, I don't care if you're at the gas station attendant or you're going to church with somebody or at the library. And so, it takes a village. It takes all of these people to make this work. So I am thrilled that, we have had the opportunity because of great support from our legislature around community health grants, around some of our rural health center funding, around loan repayment. I can't express my thanks enough for that. I think that the Rural Health Transformation Program, wow, it allows us to really take those partnerships, those things that are available to us that we have all been dreaming about and thinking about creating handshakes across them so that they were good stewards of the money, and we can show how we're able to grow into a sustainable model those particular things that are so important to our rural communities. And as Kelly and Dr. Greenblatt said, Deborah, what we want to do is we know that workforce is important to not only providing care for our communities, but that means jobs. It means opportunities to grow that vitality within our rural communities. And so there's a double win there, right? And also when we think about access to care, the Department of Information Technology and other folks have been working so hard to provide broadband to our different communities that I think here's another opportunity where we can, do handshakes and work together to create those links to all those resources across our state. And I'm so happy that we're going to have an opportunity to work on telehealth, and not only in the physician's office, but also with patients, with people who need to have that access in their homes because of the issue around healthcare, around childcare, around travel. So many people are in hourly jobs, and so often they're having to try to create access for their family members. And so I think this is just an enormous opportunity for us to come together in these regions, to create these links between these critical access points and the work that all of you have done as North Carolina citizens in your regions and your partners and your communities. We can lift that up. And I cannot tell you, I mean, I'm absolutely thrilled, and I have so much confidence in all of our rural communities. Thank you.
Thank you, Maggie. Thank you, Kelly and Larry. I hope that our audience can hear your passion and also your expertise. I thought it came through well in your introductory remarks. And so thank you all for your comments. And I just want to acknowledge to our audience participants, if you see me looking to the side, I'm just monitoring the Q&A because we want to make sure that we transition now to that portion of our town hall, because we want to get your questions in. We're graced with your presence, and we want to make sure that we can answer as many of your questions as time will permit. And so I'm going to jump right in. And again, if you see me looking to the side, it's because I want to make sure that we can ask those questions, and I can track on that. All right. So let us start with this one. What eligibility or selection criteria are you considering for the Roots Hubs? For example, must they be a nonprofit? Will they be required to have certain kinds of experience? Will they be required to partner with certain partners? And so with that question, I'm going to, why don't I start, and then Maggie asked you to join in. and sort of elaborate on that answer. And so the Roots Hubs, and the ROOTS stands for Rural Organizations Orchestrating Transformation for Sustainability. These hubs are regionally organized networks that coordinate care, deploy tailored interventions, and serve as anchors for community activities. Each of these hubs is responsible for implementing projects in primary care, chronic disease, behavioral health, and other aspects. And a critical part of that is that they will be locally governed, because we know each part of our state is different, that there's needs in our eastern part that vary from what happens in our western communities, but they will be locally governed and community tailored, and they'll be responsible for coordinating and implementing these initiatives to meet the needs of their local area. Maggie, can you speak a little bit to sort of what we'll do to select and procure the Roots Hubs?
Yeah, thank you, Deputy Secretary. And you're going to see me also look to my left, because I know people are so incredibly interested in this RFA process that I want to make sure that I'm answering that very specifically. So what we're going to do is release an RFA for the hubs. It will be important for us to establish clear criteria to govern, talk about those partnerships and sustainability. Interested communities, all of you here should watch for announcements that will provide additional guidance around that RFA. We want to do this as quickly as we possibly can, and DHHS must ensure that any of the RFAs are handled in accordance with all applicable procurement-related legal requirements and rules. So just because we know that there's a lot of interest in this, as Deborah, Deputy Secretary Farrington said earlier, it has to be fair. So that's why we're trying to make sure we're crossing all our T's and dotting all of our I's. And so you can visit the webpage essentially for the latest information and updates. It will be updated on a regular basis. And I think the important thing, and Deputy Secretary Farrington said it earlier, that you don't have to wait for that RFA. Okay, get going, y'all. You can put your partnerships to work together to begin discussing in your regions what this could look like, what you hope for. And if you look at the slide deck that was presented today across those 6 main topics, that will give you an idea of maybe how you want to structure some of your conversations before the RFA comes out. Make sure people are invited to the table who really can inform a culturally appropriate and regional approach for the needs of your region.
Maggie, thank you. I appreciate your elaborating and making those emphasis. And I apologize in advance. I've been told I'm a hard typer, so if you all hear some clicking in the background, I'll try to be more cognizant and put myself on mute when I'm looking at the questions. Let's go to the second question that we've gotten, and I'm going to ask Dr. Greenblatt if you would please answer this question. How does DHHS attempt to address maternal health deserts in rural areas? How are we going to address maternal health deserts in rural areas?
Thank you very much, Deborah. That's such an important topic. We have large disparities in our health outcomes for maternal health and also for infant health. And we plan to address the maternity care deserts via the NC Roots Hubs. And there we're going to support primary care to provide some of that prenatal care, strengthening consultations between them and obstetricians in some of our other parts of the state, improve transfer systems so that when an individual needs that higher level of care, they can be transferred quickly. We also want to implement models, proven models like the one developed at ECU. That one is called I Gave Birth, and it's a simple intervention Women who have given birth recently are asked to wear a silicone bracelet that just identifies that they have recently delivered a baby, and that identifies them to urgent cares, emergency rooms, EMS workers, that they have different needs, and this simple intervention reduced hospitalizations after childbirth by 1/3.
Thank you, Dr. Greenblatt, for the specifics around that. So that's perfect. Question number, and thank you all, audience members, for your emojis to let us know when the information we're providing is helpful. I appreciate that, and I believe our panelists do as well. Our next question asks us, what types of successes do we expect to be able to report in year 1 so that we can get year 2 funding? And I'm going to attempt to answer that question and then open it up for our panelists to be able to add some specifics. Maybe Kelly, I'll come to you so that you can talk a bit about behavioral health and what we're hoping to accomplish in year 1, some of those quick wins. I will refer you all back in answer to that question to one of the slides that we shared today. And for your reference in today's deck, it was slide 11. So when you get a copy of the deck, make a note to go back to that. And at the bottom of that slide, we listed some success measures to include that we want to have coordinated networks of care that serve rural residents that show a reduction in chronic disease burden. We have some specific numbers in our application that indicate we want to see increase in access to mental health care, and Kelly can reference a little bit of that in a minute. We want to see, I think we said a 10% reduction in rural provider vacancy rates by year 5. Now, let me just clarify, there's some early wins, and those early wins include some of the things I mentioned earlier. Securing the roots hubs, making sure that we set up sort of the infrastructure, the long-term infrastructure that will support our work long-term. So some of the things that address these success measures we'll see later, and the one that I just referenced with the 10% reduction in rural provider vacancies, that's a year 5 goal. We have some other goals, like we want to see 70 new rural practices connected to the state's health information exchange, 15% increase in rural hospital readiness for value-based payments. So some of those things will be a part of our future year's work, but immediately I think we're going to want to see the establishment of those roots hubs. We're going to want those root hubs developing their action plans, engaging their providers, and then I'll hand it over to Kelly who can talk about some of the immediate actions for year 1 on the behavioral health side.
Thank you for that, Deborah. I think one of the great things about leveraging our current infrastructure on the mental health and substance use side is that we'll be able to see some quick wins. Now, I just want to temper everyone's expectations. When you think about a quick one and a year 1 quick win and an outcome, you're not going to get a lot of people health outcomes, right? Which is what we're going to see in successive years, right? But in year 1, because we're leveraging current infrastructure, we hope to be able to report, for example, that we have launched by the end of the first year 3 new mobile outpatient treatment clinics. And that's a big deal because 3 new mobile clinics mean within 3 to 6 months, each one will serve at least 150 people in a rural area. Once you get it up and running, pretty soon you're able to get 150 people getting services. So that's pretty extraordinary. We hope to see some increases in use of good crisis services, right? More calls to 988, more folks knowing about and calling mobile crisis. We hope to be able to support maybe some more co-responder teams or additional staffing on current mobile crisis teams so their response times can go down. And you'll see us fund a couple more CCBHCs or to help reinvest in some CCBHCs that haven't had reinvestment in counties for a very long time. So a lot of it, you're going to see the enhancement of existing infrastructure. But then soon after that, in year 2, we're going to start looking at good utilization versus bad utilization, right? Are folks using crisis services? Do they know where these community clinics are? Are they going for first appointments? Are we seeing a reduction in bad utilization? Folks going to the emergency room, folks waiting 6 weeks, 12 weeks, 4 months for appointments. So quick wins are additional access points for people within the first year. And then hopefully we'll start to see the good kind of outcomes we want.
Thank you, Kelly. I appreciate that. A couple of more questions have come in through the chat. This question I'll take. It asks, what opportunities will there be for this funding to improve transportation options for people with intellectual and other developmental disabilities who live in rural areas of North Carolina? And the answer I have to that is sort of a to be decided. What we'll be doing is looking at our application to determine how can we build out activities within each of our initiatives. And so I think we would be taking opportunities in the coming months to partner with some of our initiative leads within the department and looking at what we said we could do, what are their opportunities to be able to address that. I also say in terms of it being to be determined is I would need for us to go back and look at where there's some specific parameters within the notice of funding opportunity that restricted our ability to provide transportation as an option. So that one is a bit to be determined in terms of our needing to come back to that specific question and how we can build out specific transportation options. I will say, and then just go quickly to the next question, part of the purpose in this rural health transformation program is to improve overall access to care. And one of the reasons why we chose this regionally based model is so that we could expand communities' ability to serve the rural communities. And we didn't want to focus on specific individual counties, but rather create solutions where many counties could come together and address the needs of the community. We believe that that will address transportation needs, because if regional providers or a regional entity could look across a large geographic area to be able to see where are there gaps in particular counties, then we think that that will help to mitigate this huge transportation issue that exists within our rural areas. So there's more to be determined in that area, but hopefully you get a sense of the direction that we're heading in, and we'll be coming back to you with some more specifics in this area. Maggie, I'm going to throw you a couple of questions. Let's start first with the question of how many hubs will there be? How many regions will we be trying to address?
Thank you for the question. There will be 6. And as I understand it, there are we've been so involved in this work. We talk about routes, we talk about regional hubs. We're talking about those regions, and those regions are defined by the Medicaid regions. So, coming together across those regions is going to be the important piece of all of this. I hope that clarifies some concerns that have been brought up in the chat.
Thank you, Maggie. Hopefully so. We're using the 6 Medicaid standard plan regions to sort of guide our development of these regional hubs. And I will also say that when we talk about hubs, we're really in this context talking about the regional hub leads, because you all know that these regional networks will include sort of the leader and other entities involved in that network. So if you hear us talk today about hubs, we're really talking about that lead entity that will be selected first. Okay, next question. This one also is for you, Maggie. Are there opportunities anticipated in workforce training and development for small businesses? Can you talk about what we've been thinking about in that area?
Sure. Yeah, we know that there's been a lot of work in our rural communities talking about what those needs are. So our thoughts are that the Roots Hub would be working with a technical assistance group to bring up those conversations, whether it's kindergarten through high school and community college, and really represent what the needs are for small business as well as other ways that we can ensure workforce for a rural community. So just making sure that in your regions, your workforce boards and those kinds of things will be needed to actually make sure that workforce goals have been included in what we do going forward. So it speak to a more regional and more local need.
Thank you. Thank you for that, Maggie. Kelly, I wanted to ask you a question that we got on an opportunity for digital mental health. Does that exist at all, given that rural parts of our state, in some cases, may not have access to all the smartphone technology or penetration? Can you talk about digital mental health?
Yeah, thanks for that question. And I might phone a friend with Maggie because I think we know, and we are actually already using some tools, some digital tools to give more folks access to mental health and substance use care in North Carolina. We actually sponsor a peer our peer app for folks who use substances. That's already statewide for us, including in very rural areas. We have 2 digital applications for teens that are very well received, and we're seeing good outcomes data on symptom reduction. The department has a lot of wonderful partnerships with Department of Public Constructions in schools to use telehealth in schools. And a lot of our mobile crisis teams are currently doing really interesting things. And we're looking at other states who do interesting things to be able to equip law enforcement with equipment. So if 911 is called to a scene and law enforcement is there, they can use technology to bring in a mental health professional into a situation to potentially de-escalate it and evaluate folks for care. Those are just a few examples. So when I say phone a friend in Maggie, we're very invested and interested in maximizing the use of digital mental health. It's pretty effective. It's so far here in North Carolina in early tests, people like it, and we see people feeling better for using it. The challenge does remain, of course, people's access both to phones and iPads, but even broadband technology. So I think that we're happy to bring the interventions, and we are excited about some of the things that Maggie and others are working on, so folks do have access to the broadband that they need to access some of these digital innovations. Maggie, I don't know if there's anything you want to add about broadband access.
Thanks so much, Kelly. Yeah, I mean, we have a good start with all of this, and I think for some of the school-based telehealth groups that have been working on this over years in the state, you know, our children and their families are so important to this. One program I certainly will also call out is the NC STEP program, Dr. Saeed down in at ECU, and they've really expanded a lot of the work they've done in communities. So I think, again, here's our opportunity to put these all together and figure out how we cover those places that have not had the opportunity in the past.
Thank you both for that. Just acknowledging time that we've got about 5 more minutes, so I'm going to try to cover as many more questions as I can. We have 2 questions that I'll answer, and then I'll come to Dr. Greenblatt for the next. The question is, what is the process for defining which counties, what was the process in defining which counties were considered rural? How was this defined? The definition that we use for rural health transformation application for county, for what was rural, was chosen because it included the most counties possible. It aligns with federal standards and gave North Carolina the best chance to secure resources for our rural communities. Most importantly, I want to say, though, that all rural communities will have an opportunity to apply for this funding, and we don't intend to leave out any rural county. So hopefully that explains how we define rural counties for the purposes of our application, and that it's our intent that all rural communities will be able to apply for funding opportunities. The next question that I'm going to answer, where will the new Rural Health Transformation Program Director fit within the current department structure? In other words, what is the direct reporting relationship and accountability? We intend to create a Rural Health Transformation Office, and I say create that because we're in the process of recruiting for those roles now. You will see that on our department, on our website, and I'll have to get some phone a friend help with those links. Maybe what we'll do is we'll promise to share those as a part of the follow-up from this. Make sure that maybe it's included in the slide deck. But we will recruit for those positions. This new Office of Rural Health Transformation will fit within the health portfolio, right beside our Office of Rural Health, our current Division of Public Health, currently the Division of Mental Health, Substance Use, Developmental Disability Services are all part of that portfolio, as well as our Office for Minority Health and Health Disparities. So that will be another office in the health portfolio. The Rural Health Transformation Program Director will report to me and will fit within the overall department structure through the health portfolio. All right, that was a long answer, but hopefully it gave folks what they were looking for. And then I will go to the next question because I know we're running fast towards time. Let me ask Dr. Greenblatt, can you just talk for a minute or so about how we will be supporting AI technology or AI scribe technology in transforming the delivery of primary care in our state?
Yeah, thank you, Deborah. I'll be brief here. So what Deborah is referring to is technology that uses artificial intelligence to actually write the note for the medical provider, and that it is basically taking in information in real time. And as the visit is wrapped up, essentially the note is written for the provider to go back and edit and correct. It's technology that I used when I was in practice, and many people across the state have availability of that, but not so much in our rural areas. We know the volumes of care are really high in our rural primary care settings, and this makes a big difference in the efficiency and the ability for the provider to focus on the person in front of them and not be focused on getting their note done. So thank you for giving me a chance to talk about that.
Thank you, Dr. Greenblatt. It's an exciting opportunity to use innovation to improve care and address administrative burden. Okay. So we'll take our last question just because we're at time and we need to end on time. Our final question is there a vision for how expanding nutrition access will factor into efforts to improve chronic health outcomes for rural communities? In Western North Carolina, as an example, many communities rely increasingly on pantries and nonprofits for food access since Hurricane Helene. And so I'm wondering, I don't know if, why don't I just go to Dr. Greenblatt? Can you talk a little bit about sort of how health and our addressing food access to healthy food fits into our vision for addressing health outcomes?
Absolutely. We know that when people have a supply or adequate access to healthy, nutritious food, that improves their health. And it also changes the way that they use the healthcare system, potentially saving a lot of money and improving lives. And we want our Roots Hubs to be working with community-based organizations to make sure that people who need assistance with food can get it, and also that people who are eligible for the SNAP program, the Nutrition Assistance Program, have access to those federal dollars, because that's really going to make a difference in the long run for health. And that's really what this is all about, is improving the health of our rural residents. So thank you for asking me about that.
Thank you, Dr. Greenblatt. Thank you to all the panelists. And thank you as town hall participants. We've appreciated your questions and your emojis. Look for information on our website. We will make these slides available to you, and we'll also be planning future town halls. So thank you very much. We appreciate your input and look forward to more information later. Thank you.
Ovechkin fires, he scores! Alexander Ovechkin, welcome on board. Here on Why Not, Leclerc the save, one more time.